We've talked about breast cancer as a whole on this show. Does that mean that you treat a lot of patients when it comes to the radiation aspect?
We do, because breast cancer is treated nowadays most commonly with breast conservation type surgery, like a lumpectomy, removing only the nodule of cancer.
Okay.
And then radiation is typically the treatment that follows, sometimes following chemotherapy also, but radiation is administered to eradicate any residual cancer cells. So the patient will preserve the breast and will eradicate the cancer.
Okay, and breast cancer also shows symptoms in the early stages, but as it progresses, what are some of the warning signs women might notice? We have some here, just to give you a heads up, if you will, if ever that should happen.
Yes.
God forbid. A lump in breast or under your arm. That's a very common one where women are doing the self-breast exam like when they're taking a shower.
Right, self-palpation, self-examination.
Exactly.
You may feel a density or a lump.
A change
Not
in the
necessarily painful, but just a density or a lump.
Right, and they feel it, and you kind of know your own body, right?
Right, right.
A change in the shape of your breast.
You can have a change like swelling, or like skin changes, or nipple discharge, or nipple retraction, or inversion is what we call. These are all changes in shape and appearance.
Even in the skin, doctor, you can notice some things?
Sometimes you can, yes.
Like?
Like basically redness of the skin can happen. Now, not so much on very early stages, but it can happen.
And also breast pain or tenderness. I tend to think that one could be a little bit false positive, if you will, because women like me, for example, I'm very dense, so when that ovulation cycle comes, I have a lot of tenderness, and it used to scare me a lot, but I kind of got used to it now. I know the signs.
Yeah. It's not so unusual that the patient would like have a bump or bump herself, and at that point she would like do an examination and then feel something.
Right.
It's coincidental. It probably, the lump was there already. It wasn't caused by trauma.